So for me, friendship is everything. Once I consider you a friend, it's trust, it's vulnerability, it's reciprocity, it's mutuality, empathy and compassion. All of those things. I definitely value. If I include you in my circle, I take that very, very highly.
So, welcome back to another episode of the Peace and Prosperity Podcast. I got one of the goats on here today. Like, I hope y'all are ready for a dynamic episode. I'm going to introduce you, bro, but then I'm going to let you introduce yourself too. We have Mr. Aaron Muller, the Black therapist. He's been seen everywhere: HBO, Fox Soul, BET, hip hop, everywhere. Wherever you've seen celebrity therapists, this is who I think of. And really, man, I'm just honored to be a part of your circle, honored to have our friendship, and then most importantly now, having you on the podcast. So, bro, go ahead
No,
and
for
I'll
sure,
introduce
for
yourself
sure,
too,
for
man.
sure.
Let everybody know who you are.
What's up, man? It's a pleasure to be here. Like you said, a licensed clinical social worker. I'm in private practice with my wife. We've been doing that for about five, going on 6 years. I'm an adjunct professor. I just started doing that this year. I'm really excited about that new stage, and I appreciate you being a mentor to me because you've been doing that for a minute. That was a new lane to be in. I was, just really, concerned about my
Mhm.
role as an educator and educating new social workers. So I'm excited about that. And I'm a school social worker for the Department of Ed here in New York, and I work a lot with children. And yeah, so I'm excited to be here.
Yeah, man. So y'all know this brother does a lot, and I'm thankful for our friendship, bro, because we met
Oh,
through social media.
for sure, definitely. Through social media, I would say it's a gift and a curse. Social media.
Yeah, yeah. And I appreciate you, man, having me a part of your Breaking conference last year.
No, yeah, I had to have you on there. You have a voice, and I appreciate the work that you do. So appreciate you joining in our first Black Men's Mental Health Wellness Conference. We're gonna have another one next year. I'm actually, starting the planning process, so definitely excited.
Yeah. So, bro, I want to talk about one, we're gonna talk about Black men and friendships and therapy. We're gonna get into all of that. But what does friendship mean for you, being a Black man?
Oh man, friendship is everything in terms of because I low key have like trust issues in a way, just in terms of just people's intentions. So for
Mhm.
me, friendship is everything. Once I consider you a friend, it's trust, it's vulnerability, it's reciprocity, it's mutuality, empathy and compassion. All of those things. I definitely value. If I include you in my circle, I take that very, very highly.
Yeah, and I think that's
So,
one of the ways that we were able to connect because we both had kind of had those trust issues
right.
when it comes to like trusting people. Was this something that did something happen, or was this something that's just innate in you when it comes to like trusting people?
I think it's innate. I mean, like outside, I kind of have this color lens that people are good and people are nice, and then you realize that when people have stuff that they're going through, they may not be the nicest person. I've seen
Mm.
how I'm like, that's your people. You're talking about them, so that kind of left an impression on me really early. It's like, wow, people could smile in your face and still talk bad about you. And yeah, for me, that was kind of very hurtful because it's like I'm coming in with full intention and full, just like, yo, that's my person, that's my people. You know what I'm saying? I'm not going, yeah, not talk ill about them. But I realize not everybody has that ability, and realizing that people could be your friend, but then still have like hate towards you. And I'm like, for what? So just realizing with that hate could come, just not being nice or saying mean things. And for me, that's one thing that I kind of have injustice about, is like saying cruel things about people. So that bothers me in a way. So if I see you do that, I know how to. If you do that to someone else in my face, I mean, you can do it to me too. So I know to kind of shy away from you. You understand what I'm saying? So that's why I kind of built that up. It's like, wow, people could be that way. So from that moment, I'm like, I need to find people that generally means well and means good and don't have that spirit in them, because that's kind of like a spirit, um, to have that ill will towards people.
And I noticed that about you. Like when we have our conversations, your energy. I mean, everybody goes through stuff, right? Like we're still
Right.
human, but overall, your energy is positive, it's healthy, it's not derogatory. You're not saying mean things or spiteful things about anybody, and that's definitely something that I applaud you for, and I know that that's genuine.
I
Now,
appreciate that.
yeah, seriously, bro. Now the question is, because I know people want to know, like, how do you navigate this if you have a friend or somebody who's close to you and they are starting to say mean things, or you notice that they're just how they're moving does not align with how you would do things? How would you handle that, or have you ever had that happen, and how did you handle it?
I mean, depends on, because I look at someone's ability and comprehension. If they gonna come back with, you know, combativism or just not able to, receive the information, I probably would be less inclined to respond, because I'm like, you're not going to take the information in a way that is going to be constructive. You're going to take it as an attack, and how
Mhm.
fruitful is that going to be? But my approach depends on the situation. So my approach would be like, yo, why are you talking? You know what I'm saying? Yo, you know what I'm saying? Like, come
Yeah.
on, bro. Like, and so I'll kind of finagle it that way to kind of see, how they respond to it.
Mhm.
So it depends on the situation. But if it's ongoing, I'm like, okay, that person I need to keep at bay. You know what I'm saying? I need to keep them away, so to speak. So it depends on the situation. That's Everybody's not like me, so I understand that. And
Yeah.
then maybe the person did something to them, but if it's just out of nowhere, I'm like, bro, like, like I've never, at workplace they like to talk and things like that. I've never been in that circle of like talking. I never liked it. I've been in workplaces where I know they was talking smack about me
Mhm.
per se, and I was like, I'm gonna keep you at bay. I can't be fake. That's one thing, is like it's very hard for me to be fake. So it's like, yeah, just stay away from me.
Mhm. Yeah, you
You know
gotta
what I'm
keep
saying?
your
So you come,
distance.
yeah, I don't like that, because like one thing, I won't be fake with you, but I will be. We could be cordial at work. I'm not gonna be disrespectful. That's not my thing. We could work together. We're not friends anyway. You feel me? So that's kind of like how I operate. But in my personal life, my wife is always saying, she's like, you always seeing the rose colors. She always say that. You always. So, there's situations where if I'm upset about something, or what someone did, she'd be like, wow, I know you're really upset, because she knows usually. I'd be
Uh,
like, oh, like I'll rationalize people's behavior.
so when was a time where it wasn't like Mr. Nice Aaron, like Black therapist took the therapist hat off and you had to
But this many times. I mean, yeah, I think I have a tolerance, ability to kind of compartmentalize things in terms of just like, that's who they are. I'm not going to let it affect me, because like, even though being a therapist, still go through our own stuff. I still go through my own stuff, and I don't have the capacity in the space for my stuff and somebody else's stuff. So if I'm gonna take, I'm gonna take my own
yeah.
stuff and deal with that, and try to deal with it, however I can. Somebody else's stuff, I'm not taking that on,
Mhm.
taking
Yeah.
on that energy. Now, if it's something towards me per se, or my family, now then that's when I have to govern myself accordingly and do what I have to do. Though it's not always,
Yeah.
Mr. Therapist. There's times where it's like you have to. Um, but I'm big on consequence. I have consequential thinking, and
Mhm.
to have to circle back and be like, yo, I'm sorry for acting like I don't want to do all of that. So
Have
I
you
try
done
to
that
do.
before?
I mean, I think there's been instances where I had to like circle back, and it's just like, oh man, that guilt and that like, why did I come out of character? Like, I try to control that. I hate to have to circle back and be like, I have nothing wrong with apologizing, but the
Right.
guilt and the shame, like, why did I put on this whole Broadway production? You know what I'm saying?
Yeah,
Like I think
yeah.
about that, like whether it be in front of people or work and things like. So I think about, oh, like how do I respond to this situation?
But I don't think everybody thinks forward like that all the
Nah,
time.
nah, nah, nah. And maybe that's why I'm so tired all the time because I'm always forward thinking.
Yeah,
That takes a
bro,
lot of
you be thinking about different stuff. Like,
yeah,
and it's a gift, like you said, it's a gift and a curse. Because when
for
we
real.
start to overthink, now we thinking we're planning ahead, like we're we're playing scenarios out, seeing, and we're therapists, right? So we know how this works.
Right.
But as a therapist, we still cannot therapize ourselves.
Nah, it's not good. It's not good. But I feel like it's a mixture between the skill set and then who I am as a person. So I feel like they kind of coincide in a way. I'm a
Hmm.
pretty peaceful, like if everybody know my dad, he's the most my mom said I'm a lot like him. Like he's the most chill, like he's not letting nobody sweat take any sweat off his back or
So
anything with
that's where it
anything.
comes from.
So I think that a large money comes from, and he don't have a whole. I didn't see him grow like when I was growing up. A whole bunch of friends, a whole bunch of dudes. Nah, he was about his money and working and taking care of myself and my siblings. That's all I see him do. You know, so it's like growing up, I didn't have a whole bunch of friends either
Mm. So
at
when it
all.
comes to, so you've been kind of like I don't want to say a loner. Would you say a loner
Yeah, but it's
or
pretty
low
chill.
key?
Yeah, just low key, and then I have a large family, so they kind of been like uh my circle. You know what I'm saying?
Hmm.
But as I got older, and definitely in the profession, that definitely expanded my network for sure. And through
Right.
social media, meeting yourself and and Bashe and Melvin, I've
Yeah.
met so many other brothers in the field that's become my circle, just through camaraderie and mutuality. You know what I'm saying? So and then and it's so funny, like majority of my circle is therapists. So I don't know. It's like do I do I do I get along with other what I'm saying other
People who
brothers
not.
that
Yeah.
yeah, and I have definitely others outside that are not, but majority of my friends are therapists for real. And one of my other best friends, he's not a therapist, but he's very vocal and very able to articulate himself. And we've been friends for years too. So it seems like that's the common thread.
I-
Um, you know,
Is he very therapeutic?
he is. I mean, he write poetry and all of that stuff. Very, we get along. You know what I'm saying? But very able to articulate himself, and yeah, we our relationship thrives. So I think that's the key component.
Now, how, because black male therapists, we're still rare in our field, right? There's like, I don't know, less than 4% of us are black male therapists. It's really a low number.
Right.
So when it comes to your friends who are not therapists, how do you navigate that friendship so you don't become their quasi therapist?
Well, a few of them I've um, referred to therapists. I think they appreciate having that space, or just like, yo, man, or something is going on. We'll chop it up about that.
Hmm.
Um, but I think they feel safety in knowing, my position, and that also, that did not being judgmental, being able to express themselves, all of that is available. Of course they're like, dang, I wish you could be my therapist. I'm like, already know this already. So they may throw that in there. But by now they know that can't be the case. But definitely, they've throw that in there a few times for
Yeah,
sure.
yeah. I think it's challenging. Like, I mean, because I'm a therapist too, and I feel like at times, because we've been in the profession, 10 plus years or whatnot, like it just becomes a part of you sometimes when you're having certain conversations. The next question, like you're not trying to have a therapy session, but just the way sometimes our minds think. Does that ever happen to
Yeah.
you?
Yeah, and it was like, I've heard a couple times like, oh man, I don't hear it too often, but like, okay, here comes a therapist. I'm like, really just asking a question. Um,
Yeah.
but I've been thinking about it, especially like when I don't have to have the hat on, or when I'm not in session
Mm-hmm.
right now. Is just chopping it up, just asking questions and stuff like that. So I'm happy I don't hear that. Oh, here comes a therapy or something like that. So yeah,
Yeah.
it's just it's like they forget, I forget, and it's just conversation.
But not everybody will go. At least I know my friends. Like, not all of my friends are going to go to a therapist.
Right.
A lot of them will. A lot of them will, but not 100%. So those ones that don't, they decide they're not going for whatever reason. How do you navigate that friendship? Because they still may be going through some stuff.
That's a great question. Just by being available and
Mhm.
gently reminding them that there is help out there. And one thing is that I don't push, because you have to be ready. Like you
Mm,
can't keep on pushing somebody to go to start working out the gym, or pushing them to, like, you have to be ready to give your life to Christ. You got to be ready to start going to the gym. You have to be ready to start going to therapy. So definitely not pushing it in a way that is antagonizing, but just providing support when you can, and then setting those boundaries too. Like if it's like repeated and the same thing over and over again, it's like, bro, we ain't having this conversation again, because I done told you.
right,
And
right.
right, and as a friend, you can do that too. You know what I'm saying? I done told you already. You know what I'm
It-
saying? So
yeah, I think it's way more fun being somebody's friend. Like, when you're their friend, like be the friend, not the therapist. You don't have to
nah, yeah,
switch hats,
yeah,
none of that. And you made a great point when you said people have to be ready. And I think that sometimes one, people are not aware of where their readiness level is. So they're coming to you for a quote unquote advice or therapy, but they're not even ready to receive that information from you. And then
absolutely.
we have to be conscious of where they're at. So what level are they at? Are they ready for this conversation? Are they ready for a referral, or do they just need me to listen right now? And then next conversation may be, hey, are you open to blah blah blah?
Absolutely. And here's the thing. I have clients that are still in that same space too. That they
So,
come to therapy and they still not in a space to, they want to just vent, they want to just process, and they're not ready to actually do the actual work yet. You know what I'm saying?
yeah.
So I take it the same way. You know what I'm saying? Whether it be a friend, um, or a client. Yeah, I know many clients is like, okay, so let me know where you're at now. It seems like you really still want to process. It may not be to a solution.
And
Um,
no, go ahead.
no, what I'm saying, and we have to acknowledge that and recognize that too.
Yeah, I definitely could say that. We, even myself, like, we'll know, okay, I need to go to therapy for this, but I'm not ready to, like you said, work on the solutions. I just need to be heard at this point.
Yeah, because the
Yeah.
solutions may some solutions are not cut and dry. Like, oh yeah, some solutions may be life changing.
Man, I didn't think we were going to, I mean, I should have known we were going to talk about therapy being two black therapists, but like, this is good. So you've been open about going to therapy yourself, like being an advocate
Right.
for therapy. Was that something that started grad school, before school, after? Like, how did it come about where you said, let me get behind it, on the couch?
Yeah, so I started going in grad school. I was extremely overwhelmed and with working full time and internship, and I was working a part time job. Um, I was really going through anxiety, and I wasn't able to identify it was anxiety. I was having issues breathing, and I'm
Mm.
like, yo, something's wrong with my breathing, and I was going to the doctor. A whole bunch of routine tests was being ran. I ran on the treadmill like 50 Cent did in his video with them things on him.
Yeah.
I did all of that. And it's like everything came back. I did a breathing test, everything came back normal, nothing going on. Then, and I remember this distinctly. I was like, I have anxiety. That's what this is. Like I had this epiphany on my own.
So the doctors didn't tell you.
No, the doctor didn't tell me. the doctor would tell me, it was just like after I've done every test and I'm like, they don't know, there's nothing wrong with my breathing. I'm like, my breathing is labor. Something's wrong with my breathing. When I take a deep breath, it's not a breath of fresh air. I felt like
Mm.
something was there. And I was like, yo, that's anxiety. And that for that moment, after that moment, it was very life changing. I'm like, that's what this is. Because it's like you going to the doctor, nobody can tell you what's wrong, but something's wrong with your breathing. It was very frustrating.
Yeah.
And then when I realized it was anxiety, I said, okay, I got to get me a therapist. So
Oh, so it
yeah,
was not a long. You didn't wait a long time after once you.
no, 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 because I realized that I was literally, working a full time job at a drug treatment program. So, I was doing that from 6:30 to 2:30. Caseload between 50 to 60 clients, and then there's treatment plans you got to do,
Oh
progress
my
notes, that's
gosh.
do everything. So I was doing that, then I would leave at 2:30 to get to school. Then I had internship 2 days a week. Then I had part-time job also to supplement my income. So I was working a part-time job, full-time job, and internship, and then going to school part-time from 6 to 9,
So
2 days a week.
all of that crammed up is like the stress, the
Yeah,
schedule.
yeah. This the
Yeah.
schedule, the demands of everything had something that was due. So work,
Mhm.
I had to do my notes, I had to do my treatment plans, I had to run a group. Um, then I had my part-time job where I had to do that. Then I had school where you had papers to be done. Then you have your internship where you have to show up and then do sessions. So I'm like, it's understandable. So for me, it was coming to the realization that, bro, you're overwhelmed. You have a lot going on. You do need to go to a therapist. And that was very helpful
Yeah.
going. And I've been going ever since.
Yeah, man. I think when we go to therapy, is it could be some for some of us we willingly go. For some therapists, we have to go, but it's
Right.
definitely a better experience. And then I think I'll say once you become like a client, now you understand a little bit more like what your patients experience being on the other side of the chair or whatnot.
Oh, for sure. Right. So I'm
Yeah.
definitely mindful about, responses, definitely mindful about engagement. Definitely, now that I do it virtually, so it's a bit different. I do miss the in person of going and like sitting on the couch. I let go of all of initially when I first was going, I was very mindful about, I'm like, oh, okay, this is what she's doing. Oh, I know what she's doing. You know what I'm saying? So, I was actually in school at the time.
Mm-hmm.
Um, but now it's just like I took off the hat of like being an observer and just allowed myself to just be
Yeah.
the client. And that's because a lot of people's like, how do you go to therapy? Don't you know? I'm like, when you fully submit to the process, you're not even paying attention because like it just is for once this is about you
Mhm.
unloading and unpacking. I mean, you carry so many people as a therapist, so it's like it's healthy to unload that and process all of that on top of the other roles that I serve. So I allow that opportunity just to be Aaron.
Was it easy for you to open up to your therapist?
Try to remember years ago. I mean, I've been with her since in grad school. So how many years is that?
There's a minute.
Um,
Yeah. So it's
yeah,
hard. Yeah.
you
'Cause I
know,
know when I first went, my therapist, he was like, "Man, you tough, man. You making me work."
it was like I said, it's been off and on. I would say now I resumed back, but there was a period of time where I wasn't going for a long, long time. So but now, like I said, now I'm going regularly. I'm going, bi-weekly or at a
Mhm.
minimum once a month. But I'm definitely in there now. And it definitely, as from what I recall, definitely took that moment. But I just needed to unload. It's like I'm doing a lot. Like
Mhm.
I think that was the primary, just like what is this school doing? Like why I got to do so much? Like it was a lot about like situational stuff I was in. Just like
Yeah.
this is a lot, you know.
How does your life change after therapy?
Hmm. After that, well, I would say because consider that I'm still in it, is definitely um allowed me to unpack a lot. Because while we're married, and
Mm-hmm.
I tell my black male clients that you want to have that relationship with your wife that you can talk about things, but I also feel that for me that you don't want to unload too much
Oh yeah, you mean on your partner?
on your
Yeah,
partner.
yeah. Oh yeah,
So
yeah, for sure.
yeah, yeah, to your partner, you don't want to unload too much. You have to have that boundary there, um, so that you could show up as a better partner, right? So having that space to process things so that you can show up um, better for your partner is truly important. So
Yeah.
it definitely allows me to just unpack some of that stuff.
So being married, some people um they use their partner for every single thing, right? So they're unpacking everything on their partner. They're unloading everything on their partner, good, bad, and different. What are some of the drawbacks of putting all of that on your partner and not having an outlet like a therapist?
Well, one thing it's definitely shifts that boundary setting that's so important. One, that's one. Two is that you know you want to ensure that your partner is all right as well, and it could be overwhelming just dumping so much on them, not doing a temperature check on how they're doing as well.
So would you say that your partner has been super supportive of you being in therapy? Because I know your wife is a therapist too. So that's different.
Yeah, yeah. So she, no, definitely, she checks in how I'm doing, and outside of therapy, she sees a change in my mood. She's like, "Are you all right? Is everything good? Talk to me," and stuff like that. And it's just like, even in those moments, it's just like I'm like, I'm good. Maybe some stuff I need to process for myself, but like I said, I'm very mindful about dumping too much because you don't want to overwhelm your partner as well. Now, if it's something super important, of course, it's important to share that. But I'm definitely mindful about the boundary because it's like your partner has so much to carry. Also, is that there is a space and a place for you to do that, and that's with a professional, so that there's room for you guys to talk about stuff germane to the relationship, as
Yeah.
opposed to some interpersonal stuff. I feel like is really really important, but maybe you could process with the therapist, and then maybe it could turnkey it back to your partner in kind of a more structuralized format, kind of more thought out, as opposed to just scramble and ramble and
What do you think we need to do, man, to get more in therapy?
to get more.
To get more brothers in therapy?
Oh man. Um, I mean, we all hear in conversations, everybody's talking about mental health now, from entertainers and rappers and athletes and everything like that. So
Mhm.
everybody's talking about it. About checking your mental health and all of that stuff, which I'm very happy to see and hear. But the next step is, actually wanting to go and committing to going. Another aspect of it. And I don't know if everybody needs to do that, to
Right.
go to therapy, as opposed to being mindful about your mental health, which is
Mm.
um super important. So if I really want to emphasize anything, it's as a black man, is being mindful about your mental health, not ignoring or not being aware of how you're feeling. So I feel like more awareness around ourselves and how we're coping, how we're doing, and how we're dealing with things. So as opposed to self-medicating with substances, because that's just what we do to make us feel better, or that's kind of become the norm, is understanding, why am I doing this? Right? Because we see a lot of messaging around, everybody's talking about, like I said, but what's the next thing after the talk? Like, how you want to
Yeah.
apply it to you? Right? We're all sharing each other's conversations. We're all sharing each other's um little things we making, little memes we making,
Yeah.
and little stories. Everybody got a podcast and a mic and talking. but I'm past the talk.
Yeah.
For me, and if we circle back to friendship, I'm about action. So I'm not much of a talker per se, ironically, as a
Mm-hmm.
therapist. But I'm very big on action. So I'll be like, yo, I love you, bro. Yo, you my dog. So show it to me.
Yeah. Yeah.
Hit
Yeah.
me up.
And I think that's where you probably make even a better therapist, because when you in the session, we're helping facilitate the conversation and guide the
Right.
healing, but we're not, like, if I'm in therapy now, there are some times where my therapist may do more talking, or I may be, as a therapist, doing more talking, but I'm not trying to do 80, 50, sixty
No,
percent of the talking.
no, not at all. It's
Mm-mm.
really about being it's about being an excellent listener, keen listener, and allowing people to express themselves and then repeat back what you heard them say. Because a lot of people, what they speak, or what comes out their mouth, they don't even realize what they're saying or doesn't align with their behavior.
Mhm.
So there's so much that goes into just being a therapist or just going to therapy, right? It's about, what are you saying that you want to do, and are you showing that behavior?
Bro, I think you're the first Black male therapist that I've had on the podcast, so
Yeah.
I say that, yeah, I say that I'm prefacing that, you like, yeah, because sometimes people, they can downplay what we do, or diminish. I've heard that, I remember, I think it was early on in my career where I told somebody I was a therapist, and they said, "Oh man, that's easy, man. You just talk to people."
Right.
And brother, he was dead serious. Like, he was
Right.
like, "Oh man, that's easy. You just talk to people." So, have you had that experience? And then, what do you think about that when you hear things like that?
Well, it's so funny about Shay and I was having, he was having a conversation a few months back, and he was like, "Oh, I'm kind of like a therapist," and people just, and I appreciate, that, we find our profession so dope, because social worker was frowned upon at one point, not looked at as a actual profession or taken seriously, like, medicine and law and things of that nature. So I
Mm-hmm.
appreciate where we are now. But saying that, I can't say, oh, I'm kind of like a doctor, because I give medication. I'm nowhere near. I did not go through what they go through for med school. And you didn't go through what we go through to be in this profession. And it's a lot more than just talking. And because not everybody could listen.
Mm.
And this is a lot of listening work. And man, forget about what you're doing when you're working with couples, because you're listening to one partner, you listen to other partner, because they don't hear each other no more. So now you have to listen to both partners and unpack what they're saying so the other person can receive it. That takes a lot of skill to
Tell me about it.
reframe,
Yeah. We
to
talked about
mirror.
couples. Yeah, we talked
Right,
about that. It's a lot.
right, right. To mirror, because a lot of people, we could say, could be really self-absorbed, right? And
Mm-hmm.
just want to talk because I
Mm-hmm.
sound good. I want to hear people. I want people to hear that I can articulate myself. You know what I'm saying? Everybody got, like I said, you get a mic on Amazon now. You know what I'm saying? So there's a lot of voices that we're hearing right now. A lot of voices, probably too much voices at this
Yeah.
point. But we're hearing a lot of information, a lot of um, opinions, and it's great to have an opinion. But in therapy, it's not about that. And being a therapist is not about that. It's literally listening to what somebody's saying. And essentially you have to say, like, okay, so you wanna work on being a better person. How do you want to do that? And have them express that. Okay, so how does that align with what you're doing now? Like, you're stealing right now. How does that help you be a better
Mm-hmm.
person? And hear what they say,
Yeah. My
right?
mentor told me, listen to what they're not saying.
That's it. That's
And
it.
that's and
Literally
that's
listen.
that's crucial.
That's
That's a
key.
skill. That's a
Yeah,
skill. Takes
right.
practice.
And another thing that we don't talk about, and I talk about this as an educator to future social workers and therapists, is pay attention to the detail. Ask
Mm-hmm.
questions, right? When time allows for it, ask questions. But also, it's important that you remember we have to remember when our clients come back. I remember your cousin Pookie from when you was 5 years old. I'm going to remember that detail because that makes a difference in the session. So it's not just, oh, I'm a therapist too, or no,
Yeah, people
it's
say
a
that.
lot. It's a lot that goes into this. Like when somebody sits before you, one, you want to ensure that you have the right thing to say, that you
Mhm.
are first you have to set aside your stuff. You know what I'm saying? Because we're human, right? So we have to set
Right.
aside our stuff and be present for our clients. So one is that allowing for that space. But then when that person sits down, that they're the only client that matters at this moment. So I'm remember from the last session, how did you do with your homework assignment? How's things been going with mom? How is she feeling better?
Mhm.
Checking in all of those things because you want to allow them to feel that they are the only person that matters in that moment. Recalling things that happened when they telling you a story. Oh, yeah, I remember that. You know what I'm saying? I remember you told me that. Like those things, those are key components that makes a difference when someone is sitting before you. And that builds that trust and builds that alliance.
Bro, I might need to get a session in with you. No, but seriously, man, like we talk a lot of times, and I'm like, man, I done forgot like some things that but because I think we've heard thousands of stories,
Right.
and typically in session, I'm remembering what my clients are bringing, so I'm locked in. So when it comes to like me, maybe like I don't know, like what did I wear yesterday, or taking the trash out, stuff like that. I'm not. That's not my job. I mean, it's a job, but if you are my client, I'm making sure I remember your cousin Pookie, your mom,
Right.
she fell last week. Like those are important things.
Right.
Yeah. So
Right.
it's a lot that we
But
remember.
we do, and that's why I feel like our self-care is so important and our therapy is so important because there's only so much that our brain can remember in our bandwidth, right? There's only so much
Hmm.
that we can, so things are going to fall short, such as remember take out the garbage and things like that. And so I always talk to you about having systems in place in our
Yeah.
personal life because we're doing so much that is essential that we are available one to ourselves and available to our clients because we call to do this profession. But it's important that the other systems to help our lives function better is in place. So like, what I'm saying, the food is,
Bro.
my food deliveries come in the next 2 hours or so, groceries. You
Yeah,
know what I'm
you helped
saying?
me a lot
So
with that, bro. I had the housekeeper. She was here 2 days ago. The food service, I'll do that for, a couple days. So like these things, like, and you holding me accountable to it, if I'm complaining about this or that, okay, like, bro, I told you what I do, what I'm doing. Like it's been super, super helpful. So like the accountability piece is key for sure.
absolutely.
Yeah,
Absolutely.
yeah.
That's and like you talk about friendship, that is one of the important parts about it is that one, ability to express yourself and not feel shame about it, or acknowledge that you're feeling overwhelmed. There's so much because as men, as crazy as it is, it's crazy that we feel overwhelmed. Like, yo, you a man, you feel overwhelmed? It's like,
Right. Like
yeah, that's for ladies. He doesn't feel overwhelmed. Like,
yeah.
okay, no, yeah, I feel overwhelmed. I got a lot going on, and then being receptive to the feedback, right? So I didn't shun you or anything like, bro, you
Mhm.
bugging, like you what? I'm like, how you over? No, I was like, bro, I get it, understand, and here's some suggestions, like, yo, get some systems in place. So
Mhm.
like to minimize if you run in here, run into Kroger's and run into Publix or whatever.
Yeah.
You know what I'm saying? Like, nah, forget all that. Like if you are able to, you know what I'm saying? I was like, yo, you balling out of control anyway. So you definitely could afford
No.
that.
Man, but that seriously, man, it helped. And you talk about being overwhelmed, I'm starting school in like a week. So
Sure. That's
so I'm
amazing.
like, oh my gosh, like I'm excited, but I'm also just nervous because I am already busy, and in a good way, in a good way. But it's just like people expect, like I was texting a good friend of mine, and they said they were overwhelmed. I said, yeah, man, me too. He was like, what? You too? I'm like, yeah, like we get overwhelmed, even as therapists too.
Right. They feel like you're exempt. You're not exempt from anything. So
Mm-mm.
it's I say we may have insight and ability to recognize it. That doesn't minimize or reduce or like you don't have it. It's just
Mm.
we may have more insight. We may not because we may not be a strong suit in every aspect of life.
Oh,
So it's just like yeah, we have to find means and ways to deal with it.
man, bro, this is dope, man. I see now why podcasts can go like well over an hour because I feel like we just get into it and now we about to have to wind it down, man.
Is
And
it? Well, I haven't recognized the time.
yeah, isn't that crazy? We've been on for about 40 minutes already.
Oh wow.
Dude, that's why I appreciate you. I know last year we couldn't do it. Well, we did it. Like you showed up. Like your work ethic. That's when I knew. I got to say this before we wrap up. Like I was like, when you came on the podcast last year, sick, and I'm like, man, like I'm kind of like trying to guide the conversation a little bit more because I could tell you just
I was
weren't.
struggling.
Yeah. So I'm like, okay. And then afterwards, you told me, you can I share?
Yeah,
Yeah, you told me you had COVID.
yeah,
So
yeah.
I was like, dude, one, I appreciate you for doing it. I know I put you on the spot, but I
It's
appreciate
all
you.
good.
Like, and it just was like, okay, this brother is like locked in. Like, cause you could have easily rescheduled. Easily.
Yeah, yeah. I felt bad. You know what I'm saying? Like, we made a commitment and everything, and it was Christmas week, and it's like, dang, I
Yeah.
got COVID. I was like, I think I could do it because, like, it was just the congestion was out of control. But I was like, let me try. You know what I'm saying? And that's the kind of person that I am, especially for my peoples. You know what I'm saying? I'm gonna try and do it. But yeah, it wasn't a good. The dialogue was not strong. I was struggling to breathe.
Yeah, I'm like afterwards, I'm like, you good, bro? You like, yeah, man, I'm getting over COVID. I'm like, man, you could have
I
rescheduled.
know you said that. You said
It
that.
literally, I think I have to check the date, but bro, it literally could have been
It was
like a
around this week. It was
like
around
a
this week.
year. Yeah, it could have been a
Yeah.
year for sure to the day. So man,
No, it was definitely around this time because
yeah,
we was home with the kids sick. And they didn't have no symptoms. It was just my wife and I. But it was Christmas week. So I was like, dang, my whole Christmas break, I'm with COVID.
yeah,
Um,
yeah,
yeah, but I'm glad we were able to circle back and have a fresh one, COVID free.
yeah, COVID free, bro. And this is dope, man. I appreciate you. So we're gonna definitely do a part two. Maybe we have to get Bashay and some other folks on too with us.
For sure. That'd be dope.
But let everybody know where they can follow you, find you. I know you're not taking new clients. I already know that.
I don't know. I
Okay, let
have
me not
I
speak
have
for you.
I have one or two slots here and there.
Okay,
Uh, you know, it's a new year, so we
yeah.
see influx of calls during this
Mhm.
time. I try to be available, to folks, and then, but even if you don't see me, I could connect you. I try to connect people, even if I
Right,
can't. That's the social worker in me in terms of being like an agent, a broker,
right.
connecting people with resources. You know
Yeah.
what I'm saying? I feel like that thing, that's an essential part of our role. You know what I'm saying? And emphasize that as being educated. Like we not, it's not just the clinical piece that we do, but it's connecting folks to resources. That's
Mhm.
what we do also as social workers. So I could be found on the Instagram. I was about to say the Instagram. Instagram. To get
I
older,
said
they
that.
put
I
a
said
tell.
that. I said that before, bro. I was at a speaking engagement and I was like, yeah, we got the Facebook. They was like, man, you said the Twitter.
When you get
But
older, you put the before everything. Um, so we got Instagram, the Black_therapist. So I post a lot on there. And I do Man Mondays every Monday on the Jamal Bates Morning Show, which is a Christian radio show, comes on in South Carolina and Georgia. I'm really excited about that. That's infusing my love for mental health and my love for radio.
yeah.
So I do that every Monday. And you can reach out. I have a Facebook group that I started called Black Male Therapists, which I have over 800 Black male therapists. So if I can't connect you to myself, I can connect you to someone else. around the country. So we have therapists as far west as California, Florida, all of that.
And dope, dope, dope. Yeah, go follow him. This brother is dope, man. Good friend of mine. We gonna definitely have to have you back on, bro. I really appreciate
For
it.
sure. It's a pleasure to be here, man. You got the dope podcast, you know what I'm saying?
Yeah.
And I appreciate your consistency because I started mine and just
Oh,
like
yeah,
I had a lot going on. So, I had
bro.
Aaron Talks
Yeah, it's no
and
joke, man. Like it is no joke. So
yeah, it's a lot because managing social media, I have my social media page and
yeah.
reels and so it's like to add it, I know my limit and I know my
Yeah,
bandwidth is like to do the podcast and to do the teaching and to do my full-time job and the practice. And it's like, okay, I
yeah,
had
we
to,
gotta, yeah.
yeah, I had to cut something. So
Yep, yep. Well, all right, bro. Definitely. I think I already say goodbye and all of that.
no, you can close out.
All right, let me let me close out, y'all. We are wrapping up another great episode of the Peace and Prosperity Podcast. So go ahead, check out another one, and we definitely gonna have this brother back on soon. Peace.